I was diagnosed with stage 3 breast cancer in 2005. I was told I was too young, I didn't have a family history. My husband worked at a major pharmaceutical company in the area, and they did an education piece on breast cancer. He came home and told me that one of the things he had learned was that the drug that I was taking would be like putting Miracle-Gro on it, and if that lump that I felt was actually cancer, I was helping it to grow. It was a late stage 3 based on the fact that I'd been taking this hormone. Pretty much told me that if I was lucky, I'd get to walk my oldest to kindergarten, and she was 3. So I didn't think my kids were going to remember me, and it was very difficult. You know, a lot of people can stay positive through a cancer diagnosis. I did not. He went to the president of oncology after I received my diagnosis and said, you know, my wife's in her 30s, we have 2 young girls. Where do we go? And the president of oncology at this pharmaceutical company said, well, you go to Fox Chase and you go to Dr. Lori Goldstein for your oncology, and you go to this surgeon and this radiologist. I didn't look anywhere else. Why would I? There was no hesitation whatsoever. I knew I was going to be in great hands. Now, the more that I learned afterwards, I found out exactly, you know, how great Fox Chase was. But at the time, we were new. I went on that recommendation, and you know, that was the best thing I could have done. They see cancer patients like me every day. It would be very easy for them to be jaded, and you know, I'm the 5th person they saw today who's complaining about this side effect. But I've never seen that. I've always had a lot of support from the people who work here, and it's like I'm the first person who's told them that day. So it just, which makes you feel valued as a patient, and like you're not a number, you're not bothering them, but that they really value you. I did a lot of educating myself. I learned a lot about breast cancer and about research, and fell in love with research advocacy. So a couple of years ago, I actually got to sit next to my oncologist in a room and help write a research grant that they were applying for. And I kept thinking, I wish Mom could see this now, to see me sitting next to Dr. Goldstein, you know, as a peer and helping to make a difference on the research side. I've been lucky because I volunteer here a lot at Fox Chase with the Patient Family Advisory Council. I've got to meet a lot of the doctors and a lot of the staff and get to know them on a more personal level. You do get that when you're a patient here as well, but it's a little bit harder because you're in treatment. So being on some of the committees with them, it's been really fun getting to know them on a personal level, and it's amazing some of the things that you can learn. I see what's going on here. I see the strides that are being made, and I think, okay, well, there's always the fear that the cancer is going to come back, but I know if my cancer does come back, I see what they're doing for patients who are metastatic, and I know that there would be hope even then. My oldest daughter said, Mommy, you know, when I do my report this year for my hero, I want to put you down because you do so many things to help other women, and that makes me really proud. So, what more can you ask for?